So today we'll be talking all about syphilis. So, syphilis is a preventable and curable bacterial sexually transmitted infection. It's important to note that if it's left untreated, it can cause very serious health issues. Many people with syphilis do not notice any symptoms at all, and so this can go unnoticed for many years. So the first stage of syphilis is what we call the primary syphilis. It usually lasts around 21 days. So you see a round, painless, usually a hard sore that we call a canker sore that appears around your genital, the anus, or elsewhere. And the canker sore may not be noticed and will heal within 3 to 10 days. If you do not treat this primary syphilis, it goes on to the second stage. The second stage includes a non-itchy rash, usually on the palm or the sole of the feet. Or you have these white or gray lesions appear in warm and moist areas, such as around the labia or the anus, or even at the site where the canker sore was. And these symptoms will also go away without treatment. Lastly, there is latent syphilis, and this one often has no symptoms. But when this progresses to the third and final stage of syphilis, if it's left untreated for years, this is what we call tertiary syphilis, and this can lead to brain and cardiovascular heart diseases, among many other conditions. Another important set of information to put in is that babies born with syphilis can experience rashes, inflammation in their organs, anemia or low blood count, body and joint problem, neurological conditions such as blindness, deafness, meningitis, and even not developing properly, or seizures, or what we call fits. It's important to know that syphilis is transmitted during oral, anal, or vaginal sex through contact with infectious lesions, and it can also be transmitted during pregnancy through the placenta to the baby. It's important to also note that syphilis increases your risk of acquiring other STDs like HIV, as well as gonorrhea, chlamydia, genital herpes, and many others. As regards to diagnosing syphilis, it's based on a person's clinical and sexual history, as well as their physical exam and other laboratory testing. It's important to note that there are rapid tests that are readily available that can provide the information or the results in minutes, so you can get facilitated with immediate treatment if needs be. So, as in regards to treatment, the early stage of syphilis is treated with benzathine penicillin, or what we call a BPG injection. There's also second-line treatment like doxycycline, ceftriaxone, azithromycin, which are all antibiotic medications. If you have syphilis in the later stage, we can still use the BPG injection, but you have more doses where you're usually given 1 injection per week for 3 weeks. BPG can also prevent syphilis from being passed from mother to baby. And it's important to note that babies born with syphilis or babies of mother who has untreated syphilis need to be treated right away to avoid any serious health problems. So, in a nutshell, it's important to know that syphilis is a preventable disease, and using condoms consistently and correctly is the best way to prevent syphilis and many other STIs. It can also be spread through contact with other areas of the body that are not covered by condoms, including your genitals, your anus, and your mouth. And it's important to note that people who are higher at risk for the infection should be tested at least once per year.